Back to the channel. Now let us discuss about the dorsal pedis artery. So dorsal pedis artery is actually it's a continuation of our anterior tibial artery. Of course, the anterior tibial artery is in turn a continuation of popliteal artery, and popliteal artery is of course a continuation of femoral artery. So that artery only continues down below to form our dorsalis pedis artery on the dorsum of the foot. Okay, so it is actually a chief artery of dorsum of foot. It is commonly palpated in patients with especially vaso-occlusive disease of lower, and it is of course a continuation of anterior tibial artery. So what is a course? The artery begins in front of ankle, mainly between the two malleoli, that is the medial malleoli and the lateral malleoli, right? And it passes forwards along the medial side of the dorsum of the foot to reach the proximal end of the first intermetatarsal space. So you can see first intermetatarsal space between these are metatarsal bones. So between that first intermetatarsal space here, so here it dip downwards between the two heads of first dorsal interossea. So it will dip downwards. You can see at the first dorsal metatarsal artery. So at the site of here, like it will dip downward between the two heads of first dorsal interosseous muscle, okay, and ends in sole by completing plantar arterial arch. So it will end in sole, okay, and in the sole it will mainly complete the plantar arterial arch. So here you can see this is a dorsalis pedis artery, right? So like this it passes, this is a plantar arch, in the sole it will reach a plantar arch like this, okay. So now let us discuss about the relations, like what are there. So superficial, of course, you'll have the skin, fascia, and next you'll have the inferior extensor retinaculum. So if you remember this one, this is the superior extensor retinaculum, this is the inferior extensor retinaculum. So superficial to the dorsalis pedis artery, you will have the inferior extensor retinaculum, right? And also there will be our extensor hallucis brevis muscle, okay. So it's better to see in this diagram. So you can see this one, these are the extensor hallucis brevis muscle, okay, and which crosses the artery from lateral to medial side. Actually this extensor hallucis brevis muscle crosses our dorsalis pedis artery from lateral to medial side, okay. So deep to the dorsalis pedis artery you can see a capsular ligament of ankle joint, okay, and also you can see the talus, navicular, intermediate cuneiform, you know those bones here you can see. So this is a dorsalis pedis artery, and deep to it means just inferior to it you can see a capsular ligament. This is a capsular ligament of ankle joint. You can see the talus bone which is present medially, right, and you can see the navicular bone which is present next to it medially, and you can see the intermediate cuneiform bone, right, and also different ligaments which are connecting them. So if you see medially, there will be extensor hallucis longus muscle. So yeah, this one will be better for that now. So this is dorsal pedis artery. So medially mainly we'll have the extensor digitorum longus muscle. So in this diagram you can see that muscle, extensor digitorum longus. So medial to it you will have the extensor digitorum longus muscle, okay, and the medial terminal branch of deep peroneal nerve. So this is the deep peroneal nerve, and its medial terminal branch will be, this is the lateral branch, this is the medial branch. So it will be medial to the dorsalis pedis artery. So now let us see the variations. Like sometimes the dorsalis pedis arteries may be large to compensate for small lateral plantar artery, okay, and in about 14% of normal subjects the dorsalis pedis may be replaced by perforating branch of peroneal artery. So actually sometimes this dorsalis pedis is replaced by the peroneal artery, and sometimes this artery may lie laterally rather than being medially. If you see here, this artery is medial, right, but sometimes instead of being on this side it may be on lateral side. These are some variations. So now let us move on to the branches. What are the different branches of this dorsalis pedis? So the first branch is lateral tarsal artery. As you can see here, this is the lateral tarsal artery, right? It is larger than the medial tarsal artery. You can see first this is the dorsalis pedis artery. It is giving a medial tarsal artery and the lateral tarsal artery. But the lateral tarsal artery is larger when compared with the medial tarsal artery, and it arises over the navicular bone. Of course, this side on the lateral side, of course, right, it will like over this area there will be navicular bone, right? So it will arise from the navicular bone. It passes deep to extensor digitorum brevis and mainly supplies the muscles and neighboring tarsal joints and ends in the lateral malleolar network. If you remember, in previous video I discussed about lateral and medial malleolar networks, right? So this lateral tarsal artery mainly take place part in lateral malleolar network. Okay, so remember, it will supply the extensor digitorum brevis muscle, which is over here, and it is arising upon the navicular bone. Now let us discuss about medial tarsal artery. So medial tarsal branches are 2 or 3 small ticks which join the medial malleolar network. Okay, next coming to the arcuate artery. You can see here it's like an arch-like structure, hence the name arcuate artery. Arcuate artery is large branch which arise opposite to medial cuneiform bone. Here, of course, this is a medial lateral side, so this is a medial side. The medial cuneiform bone will be here, so just opposite to that you will have the arcuate artery. So it is a large branch, runs laterally over base of metatarsal bones. Of course, here metatarsals will be there, and deep to tendons of extensor digitorum longus and extensor digitorum brevis. Mainly it ends by anastomosing with lateral tarsal and lateral plantar arteries. So you can see this is the lateral tarsal artery, and it will also anastomose with the lateral plantar artery. So it give off second, third, fourth dorsal metatarsal. You can see second, third, fourth and fifth dorsal metatarsal arteries are given by the arcuate artery. So each of which divide into dorsal digital branches for adjoining toes. So the dorsal metatarsal arteries are joined by proximal and distal perforating arteries from the sole. Okay, so mainly there are proximal and distal perforating arteries from the sole, and they will also come and join our this dorsal metatarsal arteries which are coming from arcuate artery. Next, coming to the first dorsal metatarsal artery. So you can see here, this is the first dorsal metatarsal artery, this one. So this is arising just before dorsalis pedis artery, dipping into the sole. So it gives a branch to medial side of big toe and divides into dorsal digital branches for adjacent sides of first and second toes, right? So this is about dorsalis pedis artery. Remember that dorsalis pedis artery not only supplies the dorsum of the foot, but it will also puncture over here and goes to the plantar side. You can see here on the plantar side also it is reaching, right? So let us discuss the clinical anatomy related to it. Mainly the pulsations of this dorsalis pedis artery are easily felt. You can see here how we are palpating it. They can be easily felt. Okay, especially between the tendons of extensor hallucis longus. Of course, the tendon will be here, right? Extensor hallucis longus, and also between the first tendon of extensor digitorum longus, right? So between these two tendons, exactly over here, you can palpate this dorsalis pedis artery. And however, this dorsalis pedis is congenitally absent in about like 14% of the subjects. So this is all about dorsalis pedis artery. Hope you understood this. Next we'll move on to the lateral side of the leg compartment.